As a stroke survivor, you should ask your physician about when you might be ready to participate in a stroke recovery program. At that time, you may be at one of the most vulnerable times you've ever experienced, and rehabilitation is necessary to recover what has been lost following your stroke. Rehabilitation is meant to care for yourself, to increase your independence, to reintegrate into your community, to rejoin your family at home. Every day I have the opportunity to inform patients and families about what inpatient rehab provides. When a stroke survivor comes to rehab, they receive a team approach. It can include occupational therapy to address their self-care, dressing, bathing, eating, grooming, toileting. It can also include physical therapy, mobility tasks such as standing, walking, transferring from one area to the next, and propelling a wheelchair. The more time you can spend in rehabilitative services, the more quickly you'll progress, the more quickly your function will improve and return, the more you'll learn about your condition. Rehabilitation can occur in a number of different locations. Inpatient rehab hospitals are intensive locations specially designed to focus on inpatient hospital-based therapy. A skilled nursing facility is another location where a patient may receive therapy following a stroke. It is when you're not quite well enough to participate in an intensive rehab program, but also not well enough to return home. Long-term care facilities are intended for patients who are medically stable and well enough that they do not require ongoing management or monitoring by a physician on a routine daily basis. Long-term acute care hospitals are hospitals designed to take care of patients with complex medical needs. Rehabilitation can also take place from home, utilizing a home health agency, or in an outpatient setting such as a clinic. In rehab, we like to include family members, so it's very common for family to participate in therapy sessions along with our patients. Caregivers are vital during recovery from stroke. There are a number of questions that a stroke survivor should ask before beginning their rehabilitation. Is the hospital certified to care for patients following a stroke? What medical professionals are available to care for me following my stroke? Are there special certifications or trainings that staff members participate in that make them more uniquely qualified to care for a stroke survivor? How often will my doctor see me? What is the maximum amount of therapy that will be offered in my rehab setting? My goal is that we're able to help patients return to a level of independence that they never thought, improved level of independence, improved function, and ultimately improved quality of life. Restoration is our goal.